On ABC News and ABC News Radio, welcome to Planet America's Fireside Chat. I'm John Barron.
And I'm Chaz Licciardello.
Coming up this week, one of Bernie's biggest backers, Ben Jealous, on whether Sanders can still win the presidency or indeed what Joe Biden needs to do to win over progressives. But first, an update on the COVID-19 pandemic in America. Models suggest at least 100,000 Americans will die. The daily death toll is approaching 1,000 already. 90% of Americans in at least 37 states are now being told to stay at home. And more than 6.5 million people have filed for unemployment benefits in a week. That means the unemployment rate in the United States is likely to have gone from 3.5% to over 10% in the space of a month.
Okay, well, why don't we look at the numbers as they stand internationally to begin with. In America now, they've got about 244,000 cases, more than twice as much as any other country, and with around 30,000 new cases every day. Note, by the way, that China has supposedly had only 35 new cases today. I'll be coming back to that one later. As far as deaths go, America is now at over 6,000 deaths, with about 1,000 new deaths per day, as John just said. And the government models are projecting that rate to double again in the next week or two. But there is some good news. Look at Italy there. 4,500 new cases. That sounds like a lot, but new cases in Italy have very much stabilised and are in fact on their way down, while new recoveries from COVID, that's a stat we don't talk about much, are slowly increasing. Italy was about 2 to 3 weeks ahead of America, so that is a positive sign for the future for America. But now the bad news. America doesn't have one outbreak anymore. It has at least 10. New York is obviously going wild with 93,000 cases and 9,000 more just today. If New York was a country, it would have the second most new cases in the world behind America. And it has over 2,500 deaths. But look just below New York. New Jersey has over 3,000 new cases every day and 182 more deaths a day. And it goes on. 8 states with over 1,000 new cases each every day. Each of those states are now demanding emergency resources from the government and are expected to get worse. But I've got some bad news for those states. The government's emergency stockpile of masks, gloves and medical supplies is pretty much out. So the next few weeks are going to be very tough. There is a silver lining in America as well, though. Look at the last state on that list I just showed you, Washington. It has considerably fewer new cases than the other states. Washington was the state with the first outbreak in America last month, and its new cases have basically halved over the last few weeks. So it is now, I wouldn't say completely under control, but it's on the way. In Washington, the average infected person was spreading the virus to 2.7 other people earlier in March, but now they're only spreading it to 1.4 other people. So John, it can be done. In America, it can be done with the strategies they're using. They just have to hang in there for another month or so.
It is certainly going to be a very tough few weeks or indeed months. This week, the president stopped talking about reopening the United States in time for Easter after being told by his medical experts that could see up to 2.2 million American deaths. That's if there was no mitigation. President Trump then recommended that Americans should cover their faces in public to reduce the chances of catching coronavirus. And he said if you can't get any masks...
You know, you can use a scarf. A scarf is, everybody, a lot of people have scarves, and you can use a scarf. Scarf would be very good. And my feeling is if people want to do it, there's certainly no harm to it. I would say do it, but use a scarf if you want, you know, rather than going out and getting a mask or whatever.
That discussion of what to do in the event of an absence of masks came after the president had earlier said there was something a bit fishy about the increased demand for surgical masks in New York hospitals.
How do you go from 10 to 20 to 300,000, 10 to 20,000 masks to 300,000, even though this is different? Something's going on, and you ought to look into it as reporters. Where are the masks going? Are they going out the back door?
Were you suggesting there has been inappropriate use of masks or improper conduct with supplies?
No, I want the people in New York to check. Governor Cuomo, Mayor de Blasio, that when a hospital that's getting 10,000 masks goes to 300,000 masks during the same period, people should check that because there's something going on. Well, it's not, I don't think it's hoarding. I think it's maybe worse than hoarding, but check it out.
Basically, the implication there is that hospital workers are on-selling medical equipment, such as masks, for profit. There's no evidence of that.
No, I would have thought the answer to his question about what's going on is there's a COVID problem.
Yes, they're using a lot of masks right now. Now, by the way, doctors are also saying that wearing a scarf to prevent infection is unproven. They say they simply do not know at this stage. We're too early in this epidemic. They do warn it could also be counterproductive because if people put a scarf on or a bandana, they will also be touching their face if they're trying to adjust it. Most, however, do agree that there is some virtue to this, which is why the CDC is looking at a mask order, not to prevent you from catching it, but if you've got it, particularly if you're one of these asymptomatic people who are out there, but you have a sneeze or something, a physical barrier, even if it's a scarf or a jumper or whatever it might be, could stop me giving it to you if we're on the subway. So there's that.
There is. It should be said, by the way, that the CDC were until quite recently, and possibly they still are, advising doctors who didn't have masks to use a scarf or a bandana on their website. So it seemed like double stands there. I was going to say on the mask thing, it's been a bit weird, the mask, because they originally advised people not to get masks. Forget the bandanas for a second, not to even have masks. But there are countries like Austria, Slovakia, the Czech Republic, where it's compulsory to wear masks in the street at the moment. And obviously, places like Taiwan, it's as good as compulsory, even though it's not in the law, they all do. And Taiwan's done pretty well for themselves.
Well, the big problem the United States had was that because states and cities and individual hospitals were basically saying, go to the open market to try and buy masks rather than there being a strategic supply, they wand competing with ordinary punters to basically buy these things. So they didn't want people on the streets to be buying them up because then the hospitals couldn't buy them up.
Yeah, and that obviously was a massive problem, the demand for masks. Although there may be a way forward on that one. Yes, because the FDA has just relaxed its restrictions on an Ohio company that has machines that sterilise protective masks worn by healthcare workers and so on. The company has 2 machines in Ohio right now that clean 80,000 masks a day each, and is sending more machines to New York, Seattle and Washington DC. So that's 400,000 clean masks a day, and they'll probably ramp it up even more from there. So that has got to help.
Brings to mind what Dr. Diane Hess told us on Wednesday night's Planet America when she was talking about there are so few masks now. They've got this sort of ad hoc system where they rotate 4 masks through brown paper bags marked 1, 2, 3, 4 in the hope that by the time they get back to bag number 1 and mask number 1, that the coronavirus will have died by itself. It's not a great system right now.
No, well, hopefully that will help. What would also help is if they sort out the testing once and for all. Certainly, they had some very bad lags early when it comes to testing, and Trump's strategy for dealing with those lags was basically to blame Obama.
When CDC first looked at their test, the biggest problem they had is the test didn't work. That wasn't from us. That's been there a long time.
The faulty CDC COVID test that Trump was referring to there was obviously made 3 years after Obama, but things are genuinely looking up at the moment. As of next week, there's a company, Abbott, which will be releasing to the public a test that will deliver positive results in 5 minutes and negative results in 13. And they're going to be delivering 50,000 of those tests per day. So add 50,000 tests a day to these numbers, where America has been hovering at about 100,000 tests a day for a week. Add them together, that's a lot of tests. And I'll tell you where they need those tests, because they don't have the testing happening all over the place at the moment. It's just in some places. California and Michigan in particular, they were on those COVID-10 states before. California has had 1/15 as many tests per capita as New York. It hasn't had many tests at all. Michigan, not much better. So they look bad at the moment. They might be much worse because there's just no testing going on in California and Michigan. So they need lots of tests.
So the California miracle of acting early, social distancing, etc., it may just be they haven't bothered to test all these people.
We don't know.
Right.
We don't know. And also, the other thing, New York and New Jersey both have heaps of tests, but a huge percentage of people are coming back positive. In New York, 39% of tests came back positive. In New Jersey, 43% of tests are coming back positive. And even though New York is testing more than South Korea did per capita, and New Jersey is almost as much as South Korea per capita, they're still getting so many positive results, it means that they can't get enough tests. The whole place might have COVID for all we know, because they're getting heaps and heaps and heaps of positives. So now we've got some tests, we can start cooking with gas. But even better than increased regular testing is increased antibody testing. This is something that I spoke to you about last week, John. The idea being, if you can test people's antibodies in a blood test, a simple pinprick test, only takes a minute, really cheap, costs $1, and you can get everyone to do it for almost nothing, and then you can send half of America back to work safely, knowing that they're hopefully immune to the virus.
And not going to give it to other people who are more vulnerable, so you keep the over 70s at home for the time being and send the young people back out to work.
Exactly.